So hello everyone. Today I'm gonna talk about Parkinson's disease. I chose this topic because I think it is cool and I hear about it a lot in movies and shows. I know lots of people are affected by this disease, and I decided to do some research to find out what is happening to them on a physiological level. So what does it mean for people that have this disease and the symptoms that they experience? In my PowerPoint, I will go over some causes of the disease, treatment methods, and expert opinion or personal opinion on the subject. Hope you all enjoy. The International Journal of Molecular Science states that Parkinson's disease is a common neurodegenerative disease characterized by loss of dopaminergic neurons in the pars compacta of the midbrain, substantia nigra. Parkinson's disease is basically the death of neurons, specifically in the region near the brainstem, and it causes patients to lose control of their motor functions. This neurodegenerative disorder is progressive, meaning it will get worse with time and may further implicate health conditions. I also put in my slide facts from Mayo Clinic. They introduced Parkinson's disease as a progressive nervous system disorder that affects movements. Symptoms start gradually, sometimes starting with a barely noticeable tremor in one hand, and then when your hands are shaking more common, the disorder will commonly cause stiffness or slowing of movement of the muscle. And then on the side right here, I have some motor skills symptoms, non-motor skills symptoms of people with Parkinson's disease. Okay, so the history of Parkinson's disease, it was discovered first in 1817 by this guy named James Parkinson. James was an English physician who published an essay on shaking palsy. He is credited the founder because he studied and reported 6 cases in his own practice. There was a doctor that had many patients with shaking palsies, and after studying patients and observing the symptoms, he medically declared the disease. So Parkinson's disease is named after Dr. Parkinson as a founder tribute. And the slide just gives a little bit, it shows a picture of Mr. Parkinson, and he's the first guy to describe paralysis agitans as a condition that later renamed to Parkinson's disease. Okay, so you guys are all probably wondering what Parkinson's disease, like what do people, what are the symptoms that people have, and what causes Parkinson's disease. So this topic is just really huge. It could be a reason of it could be a number of reasons, and though there are lots of symptoms, I included a few common symptoms here on the slide. And patients with Parkinson's disease experience shaking in their hands and feet, and hands may shake even at rest. A common first sign of symptom may be tremor in the lower limbs. Bradykinesia is the slow movement of patients. So sometimes when you see people with the disease, you find that their speech is slowed or delayed, or they walk slow, or they clearly have motor dysfunction. So people with Parkinson's disease can find daily tasks to be challenging, as they are less nimble and must take their time in performing tasks. This could be an effect of muscle stiffness, which is another symptom of Parkinson's disease. Stiff muscles will limit the flexibility of patients, ultimately limiting their movement. So patients may have poor postures and imbalance. Patients may even experience lack of automated movements. So simple tasks such as blinking and smiling and reflexes, which we know a lot about, are very limited or diminished completely in people with Parkinson's disease. In the later stages of the disease, patients may speak either too soft or too loud. They have slurred speech and may come off stoic, right? Like a lack of expression in their face, but that's just because they can't control their muscles as well as people that don't have the disease. So, and as the disease progresses, writing may become difficult as Parkinson's disease starts to immobilize patients' fingers. And the causes causes are really, really complex because there's just a number of them, so many different routes of why people have Parkinson's disease. It's sometimes also unknown. Though there is ongoing research for Parkinson's disease, scientists know for a fact that genes could be the biggest contributing factor to why somebody has Parkinson's disease. It's basically hereditary for a lot of folks. Acquired reasons include environmental toxin exposure, believe it or not, drug usage, both illegal and adverse reactions to prescription drugs could cause Parkinson's disease. Things such as stroke, head trauma, brain tumors, hydrocephalus, which is excess fluid around the brain, brain inflammation and infections could all lead to Parkinson's disease. There has been reports that there is unknown cases of Parkinson's disease, and it is really hard to pinpoint the exact reason for the disorder. Most patients that have Parkinson's disease are first diagnosed between the ages of 50 to 60, though we can see younger patients with Parkinson's disease that was acquired, so from the acquired pathological routes. So the physiological pathway, this is also another really complex things when we're talking about a physiological pathway on the cellular level. But according to the Tennessee Tribune, body movements are regulated by a portion of the brain called the basal ganglia, whose cells require a proper balance of two substances called dopamine and 1-acetylcholine, both involved in the transmission of nerve impulses. In Parkinson's, cells that produce dopamine began to degenerate, throwing off the balance of these two neurotransmitters. So dopamine inhibits the release of acetylcholine from nerve terminals, and both neurotransmitters need to be balanced for proper cell communication and neuron signaling. In Parkinson's disease, the portion of the brain that is responsible for releasing dopamine is degenerated, so it's gone. What is supposed to happen in normal patients is that dopamine is released to be able to be controlling our movement in both direct and indirect pathways. Our motor cortex communicates with our thalamus to signal for muscle movement, and then the substantia nigra has dopamine neurons, and low dopamine levels means that there is no fine-tuning of muscle movement. So basically, if you don't have the neuron, how's dopamine going to be transported and be able to control, how much, and be able to, be where it needs to be to allow people to have their muscle movement, right? Because more dopamine means that there's more excitement of your muscles, and if there's no dopamine, that means that you have a loss of motor function going on there. The mitochondrial dysfunction is also a major culprit for dopamine neuron loss and energy depletion. As mitochondria is a vital component of the electron transport chain, we all know that. Mitochondria deficiency can be due to drug use or toxin and pesticide exposure. So as far as treatment is concerned, patients with Parkinson's disease will not be able to regenerate neurons. Though treatment for pain management is available, dopaminergic therapy is the regulation of neurotransmitters such as, agonists, antagonists in an effort to balance dopamine. According to a peer-reviewed article on cellular and synaptic mechanisms for Parkinson's disease, levodopa agonist sulfamide, which is an enzyme inhibitor of dopamine metabolism, MAOB, which is the monoamine oxidase type B, all are proven to relieve patients of motor symptoms and neuropathic pain. And analgesics, commonly known as painkillers, are other forms of drugs that people with Parkinson's disease may take. So analgesics include like opioids, oxycodone, naloxone, codeine, and morphine. So pain modulation through painkillers are not specific to treating key molecules in the synaptic mechanism of Parkinson's disease, and the disease-related pain remains to be found. Researching and living experiments are currently being performed. Medical providers and experts hope to graft transplants from embryos into patients' affected area of the brain. So there needs to be more long-term clinical experiment success to determine the accuracy of the implants, and people are working on, our scientists are working on stem cell technology that may be able to generate dopaminergic neurons. So that's super, super cool if, our future consists of, transplants for neurons because, they're extremely tiny. So the success of that would highly depend on how advanced our technology would be at that point. Right now, it's just still in the clinical settings phase. They've ran a couple experiments, but they're still doing the clinical settings. And I think the continuation of research in laboratory and clinical settings is a crucial part in discovering new therapeutic solutions. And for my interview portion, I decided on inquiring my mom's friend, since she's had Parkinson's disease for roughly 5 years now. And she says that I've asked her, how does Parkinson's disease affect your daily life? She says that it affects her daily life because her hands do shake a lot. Sometimes her family does not allow her to drive because they're afraid that she may lose control of the wheel at any time. So she obviously is limited to the amount of activities she can physically perform. She says that she can't walk for long amounts of time, and she needs to rest frequently as well. She also states that climbing stairs can prove to be difficult for her, as her joints are not good and they take up too much of her energy when she feels very tired after she climbs stairs. So I've asked her what type of treatments is she receiving and how is she coping with her condition. She is currently taking medications and it helps with her symptoms. She does not feel any pain for the most. She gets her medications abroad because some drugs have heavier side effects than others. And she specifies that she must eat on time during every meal, otherwise she'll feel uncontrollably shaky, which is the answer to, is there anything special that she does now compared to not having the disease before? So she has to eat right on time, and if she doesn't, then she feels unwell, and she just shakes a lot. The next question is, how has your condition progressed from your first diagnosis until now? And she replied that during her first phase of her disorder, she had minimal symptoms. She thinks that may be due to her early age diagnosis. But as she's now in her early 50s, she feels that there are new symptoms, and the symptoms are increasingly difficult to control. Which led me to my last question. I asked her, what are some symptoms that she experiences? She says she personally experiences hot flashes, shaking palms and fingers. She walks lopsided and in slow motion, performs activities or daily tasks in slow motion, and she tends to have slow reactions to sounds and visuals, and occasional pain in muscles or brain. So here are all the links that I did my research from. This is my Works Cited page. Thank you everybody for attending my presentation, my little session. I hope you guys learned a few things about Parkinson's disease and can share awareness. And that's it. Thank you again. Bye-bye.